Transitional Housing webinar hosted by Red Wind Consulting. To begin today's presentation, I'd like to introduce your presenter, Victoria Ybanez. Victoria?
Thanks, Brenda. Hi everybody. This is Victoria Ybanez, and I'm the Executive Director at Red Wind Consulting. We are a tribal technical assistance provider for the Office on Violence Against Women, and we work with tribes in helping them develop a range of domestic violence and sexual assault responses. For today's call, we're going to be focusing on providing advocacy in transitional housing. And just to give you a little background of myself from within transitional housing, I have developed two different advocacy programs within a transitional housing setting, with stays ranging from a minimum of 6 months up to, well, the first one was up to a maximum of 18 months, and the second one was a maximum of 24 months. And through the work that I've done in transitional housing over the years, it's really clear to me that advocacy is different in the way we work in transitional housing. There's a lot of similarities in a real base foundation that we work in that's similar to advocacy in shelter and crisis response. But one of the significant differences with advocacy in transitional housing is the length of time and the closeness of which we're involved in people's lives. And when you have a minimum of six months up to a maximum upwards to 2 years, you really have a lot of time to be involved in the intricacies of people's lives, which means that our advocacy ends up being focused in a much more broader array of areas. And we oftentimes are not focused on immediate crisis. We may initially start with some of that crisis work, but we end up working more so over the long haul of addressing the different facets in a person's life that they need to really get on their feet and be moving in the direction that they want and see for themselves. Which for me is really exciting because we actually get a chance to see some really significant changes and to see people really step into some successes. One of the things I wanted to talk about briefly was the language that we use. A lot of advocacy talks about being victim-centered or centralizing the safety of women, and more recently, and particularly because of the work that's coming into our Indian country work around sexual assault, we're also focusing on trauma-informed care. Each of these are somewhat different, but they're also fairly similar. And the key piece is that we really let that person guide us, that their needs, their wants are central to what we're trying to do. And within that, we always want to keep clear that safety is first and foremost in there. And as we look at working with someone over the course of a longer period of time, one of the things that can happen is that people can kind of drift away from thinking about safety. But what we know about domestic violence and sexual violence is that the impacts of the violence continue to play itself out, as well as offenders can still be a problem 6 months, a year, 2 years, even down the road and longer. So we want to be thinking about safety in terms of the immediate needs of safety, as well as the long-term needs for safety, so that that person that we're working with has the ability to really be thinking about their safety needs and making strategies and plans in a way that is centralizing their own safety while not being overwhelmed with fear in the midst of trying to create a new life for themselves. We want our work to be victim-centered, and so in that, it's that our focus is on that person that we are working with. So that woman, that victim of domestic violence, that survivor of sexual assault, we want their needs to be centered in what we're doing. And oftentimes within a program, we develop structures in our programs, and the structure tends to take over and isn't necessarily being guided by this one individual. It may be guided by the needs of many victims of sexual assault or domestic violence, but we also want to make sure that we're individualizing it to the needs of this one person that's standing in front of us at this moment, that we're looking at her particular needs. And then when we think about trauma-informed care, we want to recognize that trauma plays itself out in people's lives. And in my experience in having worked in both a crisis response and emergency shelter as well as transitional housing is that I have learned that trauma manifests itself in different ways at different times. And so sometimes in a crisis response, we may not be able to see the full impact of that trauma. We may see more the immediate result of the trauma. And the reality of working over the course of a longer period of time, we're going to see trauma playing itself out. And I'll talk a little bit more about trauma and what trauma looks like here in just a minute. But we want to, as we think about transitional housing, really making sure that we're victim-centered, and in that we're letting this person guide their decision-making, guide their choices, guide the direction they are moving, and that we're not allowing safety to get lost over time in the process of the work that we're doing, and that we're recognizing how trauma plays itself out and how it may look different in different people's lives. I wanted to share this study with you because I think it says a lot about the role of the advocate and how significant our work is. This was a study that looked specifically at people, at sexual assault disclosures and who they were disclosing to and seeking help from. And as we look at this chart, it shows that the primary person they reach out to is a friend, and then second to that is a behavioral health professional. And out of this cluster of people that was looked at, advocate is the least likely person for them to reach out to. But in terms of who they identified as helping the most, this population of survivors identified advocates as being the most helpful. And that speaks volumes in terms of the work that we're doing in transitional housing. We have this window of opportunity. In crisis response and shelter response, oftentimes that window might even be only a few minutes to a few hours or a few days. Within transitional housing, we have a much broader period of time to make a difference. And knowing that we have made such a significant difference in people's lives, we really want to be aware and mindful of that, because as we're working with survivors and victims of domestic violence and sexual assault, we're going to have the potential of really helping to support the direction that women want to go in their lives as they are making decisions in their recovering and healing from the trauma of violence that they experienced, as well as putting in place the necessary support systems and resources for themselves. And we also have the opportunity to make the biggest mistakes by virtue of being involved as long and as in depth as we can be in transitional housing. So when we think of advocacy, we think of advocates as being a biased supporter. And I hear people talking about that we need to remain neutral, we need to be unbiased, those kinds of things. And for me as an advocate, I am clearly a biased person. My intent and purpose and reason for being involved is to support this victim survivor of domestic violence and sexual assault. No other reason. I'm not there to make an assessment on how she's doing. I'm not there to, evaluate whether she's a good parent or not. I am there to support her. Going back to some of that language about being victim-centered, that I need to have her needs first and foremost, and how am I supporting her in addressing that? It doesn't mean that we agree with all of her choices, but as a part of being a biased supporter, we make sure that we offer her enough information so she can make informed decisions about what she's doing for herself. And sometimes it means having some of the hard conversations with her about some of the difficult, challenging issues she's dealing with. Maybe she's not being a really good parent, and it's going to impact her in terms of her long-term security for her and her family if she doesn't become a stronger parent. Then I would want to have that candid conversation with her that may take place over multiple times, but evolve to help to inform her that what I am seeing is maybe taking her away from what she's identified as wanting in her life. One of the things that that happens, particularly in our tribal communities, our advocacy programs oftentimes are housed within our departments of behavioral health. Sometimes they're housed in human services or other departments within the tribe. But one of the challenges is that there is a focus of expectation of how we do our work. And oftentimes that comes from a case management perspective. And I'm not saying that we don't do case management. We may look at some of the aspects of ways that we're working and work to involve ourselves in helping to manage some of the situations. But first and foremost, we're always advocates. And in being an advocate, we're always going to recognize that that woman is the expert in their own life. They've gotten this far in life. They've gotten this far in terms of keeping themselves safe. Maybe some of their survival mechanisms or coping mechanisms haven't been the most healthy of choices, but they have gotten them this far. And we need to recognize that they are their own experts. We also want to make sure that we're giving voice to that person's experience. And what I mean by that is that we want to acknowledge the reality of what they're expressing to us. We want to inform them and assure them that we see them and we hear them. And then with that as they are accessing different services, we want to work with those other community practitioners in ways that ensure that this survivor's needs and their voice is being heard as well. Oftentimes I see times where someone is seeking assistance and they're given a referral, handed a phone number and said, well, go call this place. And yet the advocate has no idea of how effective this person is. They just know this resource based on a brochure or a listing in a resource directory or something like that. As a part of being able to give voice to that victim and survivor's experiences, we want to make sure that whatever we are doing in terms of helping that person connect into community resources is a viable option for them. Oftentimes we know in our own tribal communities and sometimes in the surrounding community off-reservation or off-tribal land, there are programs that may have ways that are acting out in oppressive, racist type behaviors. For instance, one woman that I'm aware of that had been sexually assaulted and was attempting to get a forensic exam, kept going to the non-native facility to get that forensic exam, knowing that the IHS facility did not provide forensic examinations for sexual assault. They didn't have the capacity. But the non-native program basically kept saying, no, we don't treat you. You need to go to the IHS facility. And the advocate just kept pushing her through the loop. no, you go, this is where you need to go. Instead of really making sure and maybe even accompanying that person to that hospital visit to say, you know, that facility is not a viable option, and as a member of the public, this is where she goes. You're the one who provides the service. And staying present to make sure that that survivor's needs are being met along the way and treated respectfully. So as an advocate, we work to ensure that survivor's voice and experience is being heard, recognized, and treated with respect. We also want to make sure that we focus on that survivor or that victim's personal sovereignty. And when we talk about personal sovereignty, we're talking about that person's choices. I've seen where programs will make a decision and say, we are going to mandate a certain type of behavior in order for you to participate in this program. One example would be mandating that a person get a protection order because they have been battered in order to be in the program. There's a few problems with that. So one of the problems is that by mandating that a person take part in getting a protection order with it not being their choice means that we're setting up that survivor in a way that may do harm to that person. That person may know that that protection order may not be a helpful tool in response to keeping that person safe, but mandating it ends up creating a situation that may be more dangerous for that survivor. And so instead of honoring that survivor's choice, we place an expectation and a requirement on that person that could have dire consequences that we may not have to live with, but the survivor does. Another example in terms of sovereignty, personal sovereignty, and a big struggle that I see happening within a lot of transitional housing programs has to do with alcohol and drug use. And I come across programs fairly frequently that are struggling with a population that have been using alcohol and drugs as a survival mechanism and a coping mechanism, and then wanting to get everybody sobered up quickly so they can work and use this valuable time they have to make significant changes in a person's life. And again, one of the things is that by making a requirement that people be drug tested, or by people having rigid rules around alcohol and drug use, we end up forcing the issue underground. People are going to use anyway, and create a structure where we're expecting a structure of a program to do the hard work and not the advocate doing the hard work. My experience as an advocate in transitional housing is I've had lots of in-depth, difficult conversations with survivors who have chronic alcohol and or drug use issues. And one of the things that has come up is that as this survival mechanism, sometimes it has been used to anesthetize the trauma impact. So when we're talking about possible repeated sexual assault and severe forms of violence perpetrated against them, numbing that down actually helps them to, in some instances, not become so overwhelmed and feeling hopeless as to end up turning to a place of being suicidal. And it's always very complicated and very tricky. And so we want to make sure that we work in ways that we are guided by what that person says they need. And if we're seeing behavior that's not helpful to getting them into those directions, then we need to do that hard work to open up those conversations as opposed to create rigid structures. The other piece I just want to add in there for OVW-funded programs is that not honoring a victim's autonomy and ability to make their own choices, their personal sovereignty, actually could even jeopardize their OVW funding because OVW sees this as a serious risk to safety as well. We are going to have another webinar in December that's going to talk about challenging issues, and I'll get more in depth on talking about some of those things, such as alcohol and drug use and a whole range of other challenging issues, particularly in that webinar. The other thing as an advocate that's different from a case manager is that we address power and control issues of the systems and society. And so, you know, one of the things that we talk about is we recognize the dynamics of power and control when we look at one individual victim having experienced violence by their intimate partner. And we can see that in an individual relationship. We can see that as a dynamic of power and control as a form of sexual assault, and how sexual assault plays itself out. But oftentimes what gets missed in terms of case management is we aren't responding to the systems and society, the bigger picture. When we look at victims and our experience, they'll come in and say, you know, what's wrong with me that, you know, that I drive people to do this to me. And they take on this self-blame for what's happened, whether it's a sexual assault or a pattern of coercive behavior through domestic violence. And the reality is we don't have those bigger conversations oftentimes that connect it to this bigger picture of how that plays out in our society and how power and control is used to dominate and oppress women in our society, and in particular Native women, and then how the systems in itself are structured in ways that play out and perpetuate power and control. Having those kinds of conversations and advocating within those systems to address systems of oppression actually help to really empower this individual and put things in a bigger context for themselves and take it away from there's something inherently wrong with me as a victim to there's something wrong with our society to allow this to happen. The other critical role as an advocate is critical thinking. When I think about critical thinking, what's so important about that is about we engage in a process with the survivors to find their own answers, come to their own, answer their own questions, come to their own understanding of how things work. We don't completely withhold all our knowledge and information, but we don't give all the answers. People will learn better, develop a deeper understanding of what transpires if they are engaged in their own process of looking at what caused this, right? Why did this happen? Where does this come from? And so as an advocate, we want to work with survivors in a process of engaging them in their own critical thinking, in their own examination of what's happening in their lives, and in that what they can do to move in the direction that they see and envision for their futures, which is very different from case management. And as an advocate in transitional housing, it really is a process. So we will have a much longer period of time to have those conversations and to evolve the conversation, to unwrap different areas and explore them together. I know for myself as an advocate over the years, one of the things that I always really enjoyed was the opportunity to go places and sit with women, whether it was going to the food shelf and to sit and wait for picking up groceries from the food shelf, or whether it was going and sitting in the waiting room while they were, waiting to get their public assistance appointment. just different places where we could sit and talk. And in that, being able to explore those different areas, helping to get a better understanding of how she sees what's happening in her life is taking place and what her options are, as well as her ability to dig deeper and look at why did this happen. And that's a valuable thing to understand is why did this happen? And it moves it away from there's something wrong with me to this bigger picture in our society. And so as an advocate, we're really looking at women's truths, what's, their reality, their experiences. And in that, we learn from the multiple realities and multiple experiences of all of the women we work with. And we carry that forward into communicating with this one individual person in the moment that we're talking with and spending time with. So I wanted to talk a little bit about the way women show trauma. And a little bit about trauma in itself. One of the things that many of you are probably aware of that kind of that phrase, fight or flight. Like in the moment you have this immediate reaction to something and you're either going to stand your ground and fight it or you're going to run to protect yourself. The other piece in there that doesn't get talked about very often is freeze. So there's freeze, flight, or fight, where we just kind of freeze in the moment. And sometimes in that moment there's a dissociation that happens where we even detach to some degree from our bodies and our minds. And people talk about like it was almost like I was watching myself and seeing this happen. And so they've frozen to some degree, but they've dissociated in there. And then the fight is an act of resistance. And then the flight, obviously is running away, fleeing, trying to get away. And so when we think about those three aspects of freeze, fight, and flight, those are very ancient reactions. So when I say that, those are built into our body chemistry. These aren't something about, oh, in my mind I made a decision, I'm going to freeze, and if I stood really still, they wouldn't notice me. These are reactions in our body that happen that were necessary for survival. These are ancestral ways that were necessary for survival. So thinking about being in danger, hiding in the brush, you freeze, so you've got, maybe you're being preyed upon by a large animal, and if you hold yourself perfectly still, you won't be seen. And that's a survival mechanism that's very ancient in our body. And the same thing in terms of resisting and running as well. It's also, it's a survival mechanism that's hardwired inside our body. Then with victims of sexual assault and domestic violence, that the trauma that we experience in an incident or multiple incidents it affects us. And so I know for myself on a personal level, some of my own experience was a freeze to the point to where it was like almost like I moved 20 feet behind me and I could see myself, and it was like if I don't breathe, nobody would notice me. And we see that with women, that there's oftentimes people will hold their breath. They're afraid, they feel uncomfortable, they feel unsafe, and I don't know about you, but I can even hear my breath, and so that's the other thing. It's like even holding your breath just because you don't want anybody to hear it either. So when women come into our program, into transitional housing, women come in different ways, and the way they experience trauma and the way they react to it and have internalized it is different from one person to the next. And so there'll be a woman that we'll be working with, and those of you who have been doing advocacy for a while will have these memories of women that have had a real flat effect. They really didn't have much emotion. They didn't seem happy. They didn't seem sad. They just were kind of numb. And then there are also women that you'll see that like, okay, it's time, I'm making changes in my life, things have got to change, they're jumping in, they're taking charge, you know, they're just eager, ready to go, get involved with it. Other women will come in and they'll be really angry and filled with rage. And I remember one woman I worked with who would yell at me half the time I talked to her, and literally it felt like she was, you know, as she was yelling, she was blowing my hair back. But I would imagine if I were watching that scenario playing out that my hair wasn't, but her voice and her rage was so strong it felt that way. And we'll experience women in a whole range of any one of those extremes. And the reality is one situation may tap into one way, and another situation may tap into another way, or a variation thereof. And so when we talk about being trauma-informed as an advocacy program working with those in transitional housing, we're going to recognize how trauma is going to play out in their lives and how it's going to affect them. And it's going to affect the way we advocate with them. So if somebody is immobilized, giving them a list of things to do is not going to go anywhere. We're going to set up a dynamic where they're going to feel bad about themselves because they weren't able to follow through on anything. And we may get frustrated because they didn't follow through on anything. And so we want to recognize the impact of trauma and how that may play itself out and be aware of how we interact with that person at that time. I hear people talk about codependency. We don't want to work in a way to develop codependency, is the phrase I often hear come out of different advocates' voices. And the reality is we're confusing different issues. Codependency is a language and a term that's been coined in the chemical dependency field. And not to say that we don't have people who are chemically dependent, but we are not a chemical dependency program. We are here to work with victims and survivors of domestic violence and work with them in ways to support them in making choices to get their feet solid on the ground. So codependency really shouldn't even be a part of the discussion. Someone in trauma may need to be handheld for a period of time to help support them to move from that immobilized place to start to move forward and to be able to see options and take actions. I know sometimes for myself that if I'm feeling really overwhelmed, just the idea of picking up a phone and talking to a stranger is could almost be paralyzing. And we need to realize that and not do things that are going to further reinforce the difficult place that people are at. So when we think about what survivors need, transitional housing really is about creating a time and space for people to get on their feet. And when you think about your own life and having any form of personal crisis in your life, there were days that you were able to get things done, and there were days you could not do a single thing. You couldn't even maybe get out of bed that day or even hop in the shower and take a shower. But then, you know, a week or two later, you went through and cleaned the house from top to bottom. You had all kind of energy. So if we think about a time and space for survivors to get on their feet, we want to recognize that that time and space and how they use it is going to vary from day to day to day. We are working with people in transitional housing, which is in their living situation. So their homes, we are working with people in their homes, whether that's housing within our program or whether it's helping them secure housing through a private landlord. We are still working with them within their personal lives, within their homes. And in my own personal home, as somebody who's not dealing with trauma in my life today, for the most part, that There's days my house is presentable for company, and there's days my house is not. We want to make sure that how we interact with people, that we don't take one snippet of time and make a judgment of who this person is. We need to recognize that people have different processes. As we're working with them, we want to support them in making decisions and looking at the different kinds of options that they have. And when we think about decision making, we want to think about it in terms of layers. It's not going to be something that we start off with, let's make the big decision on what we're going to do, to support ourselves for the next 20 years of our lives. We don't start there. We start with, what do we need for immediate income? And then we start to build. Because if we start with the decisions that are too large, we start to build in hopelessness. And we want to have a focus of hope and something positive to look toward the future. So we build dreams that people can walk toward. And in that, we might look toward some of those larger dreams way out in the future. But we want to always make sure we keep our steps focused somewhat closer towards where we can have success. And in that, we want to support that survivor in their own decision making. And if someone can't make a decision in the moment, how do we peel that back a little bit and help them make a smaller decision, or give a little bit more time for that decision, whether it's a few more hours or a few more days or weeks to make a decision. I recently fell down and injured myself, and it was interesting when I was in the emergency room getting assistance. People were wanting me to make all kinds of decisions, and thank goodness I'm an advocate, because I just said, stop. Everybody just stop. I need you to stop doing that because I need to focus on this. And I was clear with what I needed to do. I wasn't dealing with long-term trauma. I was dealing with an immediate trauma. We want to recognize how long-term trauma plays itself out. And sometimes as an advocate, we need to be the ones that have the eyes on the fuller, bigger situation and be able to say, okay, everybody stop. Let's just stop and figure out which piece needs to be taken care of now. Oftentimes in transitional housing, we'll find that multiple practitioners might be involved in this person's life, and sometimes there'll be a request that there be a case management situation, and in there everybody wants their needs met. As a practitioner, well, your role as an advocate is to make sure that survivors' needs are met. So when we think of our scope of services in transitional housing, we're looking at the immediate needs for that survivor. The immediate needs being, do they have income? Do they have food in the house? Their basic shelter? Do they have electricity? Some of those just really basic, what do you need today type of immediate needs. Or what do you need this week? And then safety needs, again, thinking, what do you need today and what do you need in this next few days to weeks? But also starting to move that picture of safety out in a longer direction to look toward the longer-term future. And as we think of safety needs, we want to intertwine in there the needs of the children. As long as there are children in common with the offender, safety planning really needs to be almost a lifetime effect, because those children in common will keep those lives intertwined and connected. We want to look at the personal and family needs. And so when we think about the personal needs, it might be needs for physical care, so it might be the needs for medical care. And a lot of times we think about that in terms of injuries, but it's more than that. People living in trauma oftentimes are not going in for physical to get their, mammogram done, to get their annual physical with their doctor to get the blood work to check to see how they're doing. And so there might be other medical needs outside of injuries that might need to be cared for that were just pushed back because of the trauma was taking up too much space and time to address or to live with. And then as family needs, the other thing that will happen is that within the children, there's behavioral issues the children may be playing out that's a product of the domestic violence, as well as the children have needs in terms of whether it's preschool or grade school or high school. They also might have medical needs that need to be cared for as well, and then social needs for the family as a unit and individually need to be addressed. It's an important part of development and well-being for all of us to have a balanced social connections. And then economic needs. So again, starting more immediately, what do we need in terms of right now for our economic needs? Do we need to apply for public assistance so that we can get some basic resources to purchase some of the personal care items that we need? And what do we need to be able to support ourselves in the long run? What is it going to take us to get there? Which may range from, well, I had a good experience with a job, so I just need to refresh some things and get back out there and look for a job once I'm in a place to be able to do that. Or I may need to put in place some skills to get me to a place to be able to address some of those economic needs. And the other thing which connects in there in terms of immediate needs, safety needs, and personal needs is some of the behavioral health, mental health type care that people might need. Not everybody who is a victim of domestic violence needs mental health care, but some do, and that's an important aspect of being able to offer them an option that's going to be helpful. And mental health practitioners that are educated and understand the issues around domestic violence and sexual violence. And then also, when I say safety, that when we look at survivors of domestic violence or survivors of sexual assault, survivors have a high potential risk for having suicidal ideation. And so we want to make sure that we have the resources and the wherewithal to pay attention to that and to be able to help them connect to the mental health resources to support them. So in transitional housing, we really are looking at the opportunity to have a really comprehensive, holistic approach. And one of the things that I think is really important is that in that holistic approach that we really have time and space for people to have rest. One of the things, as advocates, oftentimes we don't talk about how much stress people are under as a result of the violence, whether it's domestic violence or a sexual assault or multiple sexual assaults or a combination of domestic violence and sexual assault. And part of our bodies being healthy and in balance, we require rest. We require time for our bodies to heal. And as we're working with people in transitional housing, we are working outside of that immediate crisis most of the time. And we want to make sure that as we're working with people that we're taking an approach that comes from a balanced approach. And so personal well-being and rest, the medical care, the physical care, immediate and long-term safety, the range of legal options, forensic examinations, and that can also be true not only for domestic violence or sexual assault, but also for victims of domestic violence. Having a forensic exam to be able to collect any evidence from the injuries might be a helpful option. And again, not necessarily meaning that a person has to report, but it allows that evidence to be collected. Assistive resources, and so when we think about assistive resources, it's like, what kind of resources are needed to help this individual in this household? And as we think about assistive, we want to think about people with different abilities, whether that's different physical abilities that they have limited access because of their physical abilities, vision, hearing, resources that might be necessary. One woman I worked with in transitional housing years ago came into our program and had lost her hearing as a result of the physical violence that took place. And so she really struggled with being able to even communicate on basic levels. It was frustrating for her to have to try to write things out. And then just even having some of the resources she needed in her apartment to be able to have an alarm clock when you can't hear the alarm go off. And so we needed as advocates to know the resources in the community and how to be able to be responsive in those ways. And then traditional activities and ceremonies. As we're working with households and people in our program, we want to be aware of the resources, the traditional culturally specific resources that we have within our tribe and in our surrounding community to be able to offer program participants. Now, some participants in our program may be very traditional in that they might embrace that very readily and even ask for that. And we want to be ready to offer them options and support them in accessing what they need for their own personal healing in a culturally specific way. Others that are in our program may be somewhat assimilated and may not see that as a viable option for themselves initially. But because they don't initially ask for it or want it, doesn't mean we stop offering traditional resources. We don't want to push it to the point of making things uncomfortable, but we still want to offer it as an opportunity for people because they may change their mind later and decide that that might be a missing piece in their own personal well-being and add to some of their long-term healing. So I encourage you to be aware of that and encourage you to offer that to the different program participants that you work with. Mental health care, I think, is an important option to offer and recognize that not everybody needs it. And maybe at one point you might think they might need it, offer it. If they choose not to do it, just put it aside for now. They may be ready at a later point in time. Long-term housing assistance also is a critical part of our holistic approach. So while we're working with them for that minimum of 6 months upwards to 2 years, we may be providing some housing assistance, but we want to be working with them right early on in the beginning, within the first several months, helping them think about what can be done, what actions can be taken that's going to help them maintain long-term housing. And so I was just working with a tribe recently where they had about 400 people on their tribal housing waiting list. And we were having a conversation about how important it was for them to recognize, they had limited housing stock, as many tribes do, but what we were talking about was the importance of having some priorities for people that had domestic violence situations to be able to access tribal housing. And they had never had a conversation like that before and didn't realize that it was something that they could do, as well as that it was an important piece to make available for tribal members. And so when you think about working on long-term housing assistance, be creative. There's a way to work with some of the existing structures and challenge them. I mean, that's our systems advocacy, challenge them to rethink some of the ways they're doing things to help meet the needs of those that you're working with, as well as how are you going to then prepare them for being able to get into housing. So say, for instance, one of the issues that that a household might have is that the woman has outstanding debt with the Tribal Housing Authority. So then you might want to be working with that person over the long term on helping them to address this outstanding debt and then build up a history of payment on their rent so that there's a good positive history that can show for the last year and a half she's been paying her rent on time and what she's supposed to be paying. And then employment, education, and assistance. We want to make sure that that we're looking at long-term ability to support themselves. So that's going to be public assistance. That's going to be things like TANF, and it's also going to be things like Social Security Disability, SSDI, if they're applicable. There might be some benefits through the Veterans Administration if they're a veteran. And then employment options. What are the ways to build skill to move to having some ability to have, to be able to support themselves? And so they might have a basic skill that's going to get them entry level, but what's the plan to get them beyond that? And help them to start to think about that and plan for that and take action for that. And then the children, which I mentioned before about their educational needs, social needs, and some of their behavioral needs. And then with that, when we think about the children's needs, we also want to think about the role of the parent and how that's going to play out and what needs to be done to repair harm that's been done to that parenting role as a result of the violence itself. So as an advocate, so when we think about that holistic approach, it's like, wow, we're doing everything. And so I think it's important for us to really think about the range of skills that an advocate needs, but at the same time, we also want to recognize the resources we have in the community. My experience in doing advocacy is I'm not a mental health professional. So I am not going to do counseling with a victim or a survivor in the program that I'm working with. I'm not a trained professional. That's not my role. But I do want to know who the trained professionals are. I want to know that they're going to be a good resource. I want to know if they might have any particular biases. So if the trained professionals are off reservation and they're non-native, are these trained professionals going to have biases against Native victims or Native people? So if I know that, I'm not going to refer them there. Or if that's the only option, then I'm going to say, well, I've heard from people, this is what I know, but, let's think about how you can interview this person so that you can make a good decision and have a positive experience. So as an advocate, we want to have the ability to really spend time with an individual in the moment as we're working with them. And as we do our step away from that person, what do we need to do to follow up with them? What are the kinds of ways that we need to be communicating with this person that might be different than the way we communicate with another person we were working with? And then also, how do we model positive behaviors? So if we're working at helping them to understand good positive self-care as one component of their healing process from the trauma, and then we are demonstrating chaotic behavior and living a life out of balance, we are contradicting our message. So we want to think about how we are modeling our behaviors. How are we talking about hard things? how are we setting priorities in terms of work? Oftentimes we'll see program participants, they have been living with crisis, so they come into the program and they're operating out of crisis. And what happens then is programs can either go one of two ways. They can either follow that and learn from those that they're working with and operate out of crisis, or they can take the lead and model a behavior of calm and planning and setting priorities and limits and leading it as opposed to following the crisis. And so as an advocate, we want to be really mindful of the way that we ourselves are communicating and carrying ourselves as we are working at educating and supporting a survivor in the work that we do. And then as advocates, building our capacity is really important. As I said, we can't do all things. We are not, we don't have the ability to do, to work really clearly and effectively with someone who is suicidal. So we want to develop our community resources and with that, work with our community resources to educate us on how to make good referrals, how to see situations unfolding in front of us so that we know that somebody needs help in a certain area, and to be able to give us some of the stronger skills. And then we also want to have the ability to resolve some conflict. If any time we're working with people, there's going to be conflict and disagreement, and we need to have skills to be able to open up and have difficult conversations where there may be disagreement and maybe even tension that will occur, and do that in a way that does not create more tension, create more conflict, create more problems. Ways that we can open things up gently and know when to stop and leave them sit for a while, or know when to dig deeper. We also need to develop our skills on asking questions in a way that don't border on interrogation, but engage survivors in their own critical thinking skills so that they can dig deeper and make a bit better, make better sense of what happened in their lives and understand. So as we think about building capacity, we want to work at identifying the resources for the staff as a whole, and then also as an advocate, really thinking about, so what else do I need? Do that critical examination for ourselves and really be honest. I'm uncomfortable, one area of honesty might be to say, I'm uncomfortable working with a lesbian. I don't know enough about it, so I feel awkward. So if I can acknowledge that about myself, then I can ask for some support and resources to help me with it. Or how do I talk to somebody when I'm seeing that their parenting looks problematic without making things worse by jumping the levels and taking it to a problem, taking it to a situation of child protective services when it only is some poor parenting skills that need to be strengthened. So good self-reflection on what we need to expand our ability to work more effectively, I think, is more helpful. And as a staff, being able to talk amongst yourselves to come into a common understanding of what's going to be most helpful as the approach for your program. So I want to stop here. I've covered quite a bit of information, and I'd like to give an opportunity for participants to ask any questions or make any comments that they might have. So I'm going to turn it back to you, Brenda, to see if there's been any questions. And if you haven't written a question in the chat box, There's also, you can raise your hand in the upper bar on your screen there. There's a little person with a hand raised, and if you clicked on that, you can raise your hand and get called on if you've got a question. Okay, so it doesn't look like there's any questions today. So I just wanted to say that we have a few more webinars coming up next month on December 16th, which is a Tuesday, working with challenging issues. That's where we're going to get more in-depth on a range of different challenges that programs deal with on a consistent basis. And then on Thursday, December 18th, we'll be focusing on safety planning. These dates and topics are listed on our website at www.red-win.net. And then on this last slide, you also have the website address there for you. So I just want to thank you all for joining us today and look forward to hearing from you on one of our next webinars. Thank you.
We'd like to thank Victoria for her presentation today. This concludes the session. Thank you and have a great day.